Hello, this is Nurse Practitioner Abby from Integrative Medical of Rockford, here with your Integrative Chat. Now, 2 weeks ago when we spoke, I started part one of a hypertensive series. So we went through part one where we talked about what hypertension was, what are some of the causes, and then some basic lifestyle changes that could be implemented. Today, this is part two, and as promised, we're going to talk about some of the major medications that are used, or the more popular ones, and then we're going to talk about some supplements that can also be used to treat blood pressure. So let's start with different types of medications. So the major ones you have would be your beta blockers, and these guys work in a way that allows the heart to beat a little bit slower and with less force. So when you have a slower heart rate, a slower heartbeat, and less force, guess what? Your blood pressure will decrease. An example of a popular beta blocker would be your metoprolol. Another category would be your diuretics. And a diuretic works in a way that decreases the amount of fluid, or the fluid volume, in your arteries and in your veins. And when you have less fluid there, you're also going to have a decrease in that blood pressure. A good example would be your hydrochlorothiazide. This actually is also used if you have any swelling in the body. A lot of people would be put on this medication because they have fluid in the feet, or even sometimes fluid in other parts of the body. Another big category, and I kind of like these guys, they're kind of cool, is your calcium channel blockers. Calcium is needed to have the heart contract and the vessels to contract. So when you block the amount of calcium that's actually entering that cell, you're going to have a decreased contraction. It's not as strong, and then your blood pressure will actually go down. So this actually allows the vessels to relax and open up, and then that is what will decrease your blood pressure. An example of that would be Norvasc. And finally, we have the ACE inhibitors. And these are a nice type of drug as well. They help to relax your veins, and that way it lowers your blood pressure. A popular one would be your lisinopril. So those are your meds. Here are the heavy hitters for your supplements. And again, if you have high blood pressure, always consult with a healthcare practitioner to make sure you're on the right medication. And if you're ever even dreaming of going on a supplement, please contact someone so you know you're doing it well. One of the things a supplement does is some of them work the same way as a hypertensive med. So if you're on a specific class of medication and then you're taking a supplement that's in that same class, you have your blood pressure go too low. So you always want to consult with someone before doing this. So one of the big ones is magnesium. I love magnesium. It's important for just about every part of your body's function. But as it pertains to the heart, it's a really good one to put together with a blood pressure medication. And it acts as a natural calcium channel blocker. So I talked earlier about those blockers that don't allow as much calcium to come into the cell. So it's going to decrease your blood pressure that way. It's also good for the lining of the arteries and the veins as well. And it also helps with inflammation. So another good one is your fish oil. And I don't just like fish oil for hypertension, but whenever you talk cardioprotective, you want your fish oil. And the doses will range from what you should take to what you shouldn't take, really based on you as a person and your health care and your health concerns. So the fish oil is good because it lowers your systolic as well as your diastolic blood pressure. That's that top number and the bottom number. It's an excellent for inflammation, and it also helps the lining of the inside of those arteries and veins. And then we have CoQ10. CoQ10 is a great antioxidant, and this one helps. It acts to dilate those arteries, those veins, open them up, and whenever you have an opening up, you're going to have a decrease in blood pressure. And it also improves the lining of those arteries in your veins. And then there's one that I don't hear about a whole lot, but it works really nicely, and that's pomegranate extract. It's similar to the class of drugs that we talked about, those ACE inhibitors, and it helps to relax the veins, relax the arteries, and decrease blood pressure. There are lots more supplements that can be used, but these are what I call the heavy hitters, the ones that I see most often in practice, the ones I use most often in practice. So there you go. There are options when it comes to managing your blood pressure. The most important thing, though, is to realize that is high, and then to find someone who can help you walk through your options, whether it's medication or whether it's supplementation. Always, always, you want that foundation of diet and lifestyle. That's a good place to start. Get the weight loss on, and then there are other things we can add on that. So if you like what you heard today and you want to find out more, please contact us at our office at 779-423-2044. You can look us up on our website at imorrockford.com. If you like this, let somebody else know what we're talking about here. We are here to change lives. So I will see you at our next integrative chat, or better yet, at the office. I'm Nurse Practitioner Abby. You guys have a great day.